And as the rise in cases continues in multiple states, we welcome Dr. Timothy Quinn. He is a family physician in Mississippi. That's one of the hardest hit states in the country. Doctor, welcome to Prime.
Hey, thank you for having me.
So public health experts are calling this a pandemic of the unvaccinated, and you've been through all of it the last year and a half. To see cases rise like this again, when a vaccine is readily available, what is this like for you?
I mean, it's frustrating as a physician. We work very hard. I actually work with the city of Jackson, our capital here in Mississippi. I also work with the Mississippi State Department of Health. And there are a lot of initiatives in place, and a lot of us physicians are working very hard to encourage our fellow Mississippians to get vaccinated. We have very robust information campaigns, and we keep pounding, and we're just hoping that we can continue and just get more results.
What do you tell patients who are reluctant to get the vaccine?
Well, basically what we do is we educate them and we help them dispel a lot of the myths that are out there, a lot of this misinformation that is false. I mean, you would not believe some of the information that we receive on a daily basis in our practice. We have so many patients to come in, but what we do is we try to just give them the right information and be very encouraging. Now, one thing that is really effective during this time of hesitancy, which is late in the vaccination status, is that Mississippi State Department of Health is working very closely with small practices like our practice, Quinn Healthcare, where I've been working for 18 years. And due to this 18 years of experience, there's a lot of trust between me and my patients. And the Mississippi State Department of Health recognizes this. So they're putting a lot of resources towards the campaign, working with these primary care clinics and these clinics in the Delta, the more rural areas. So there's more of an interface between the physician and the patient, and we feel that we'll get better results that way.
Yeah, relationships really do matter, and trust matters. How is this new wave of the Delta variant different than the cases you saw at the start of the pandemic?
Well, what's going on right now is a lot of reports are coming in. As you know, has been reported, we have a lot of children that are being admitted to the hospital. A lot of children are getting sicker. Right now, the latest report revealed that 7 children were in the ICU and 2 children were on ventilators. And what was reported was children have been contracting COVID-19, but not to the level of sickness that we're seeing with this Delta variant, which is very, very worrisome, because if that's the case, that means that it can be more deadly, and there's a higher potential that we can lose more lives.
And not to mention, are there fears of hospitals and healthcare workers being overwhelmed again, like we saw over the past year and a half?
That is correct. I mean, it's a very scary time right now, but what we're really trying to do is work very hard to push vaccinations, get more people vaccinated, because what happens is the fewer people that get vaccinated, the more of an opportunity for more people to get infected. And then there's more of an opportunity for more variants to emerge. Because basically what happens is when someone gets infected, the virus replicates in their system, and then they release the virus. But some of these replicated copies might be a little bit different. They're mutant strains. They're different than the others. But these mutant strains, like the Delta variant, which is being proven, is it's stronger, so it's able to survive even more and infect more people, and that's why it's becoming the dominant variant. So what we really have to do is get more people vaccinated, slow down this opportunity of these breeding grounds of these new variants that could be even more deadly, and we can slow this pandemic down and bring it to a halt, which we really need, because we don't want to lose any more lives.
And quickly, before I let you go, we see LA County is returning to a mask mandate. Is there a danger that people who are vaccinated can also get sick and infected by someone who's not vaccinated?
I mean, this is true, because even in our clinic where we service a lot of patients, we're getting patients to come in that were vaccinated and now they're reinfected. It's a lot less of a chance, and the science is showing that these patients tend to fare better, meaning they get less sick. But then you have to think about those with chronic medical conditions and the elderly who have very weakened immune system, and that's where the risk really kicks in.
All right, Dr. Quinn, thank you so much. Really important information from a trusted source. We appreciate having you.
Hey, thank you for having me.